about the First Amendment, which is the Mental Health Parity Amendment. And I'd like to add my thanks to the staffs, both the Democratic and Republican staffs, for really working late into the night, Monday night, to help us bring this to a consensus. This is a strong bipartisan proposal to improve the enforcement of existing mental health parity requirements. Senator Murphy's had a major role in this. I imagine he'll want to speak to it in addition, and we'll welcome that. Basically, mental health parity means that if a health plan covers mental health and substance abuse benefits, such as treatment for an eating disorder, then the health plan must provide that coverage in a manner that is, quote, in parity, unquote, or similar to the coverage they provide for a medical or surgical benefit such as a treatment for cancer. Since the Mental Health Parity Act passed in 1996 and was later expanded, there have been concerns about how health plans make coverage decisions under these laws and how the appropriate federal and state agencies have been enforcing them. So these are some of the steps this bill takes to address those concerns. Number one, it requires the Office of Inspector General at the Department of Health and Human Services to issue a compliance program guidance to provide examples of compliance and non-compliance with existing mental health parity laws. This guidance will be based on former investigations and legal findings and will provide health plans, patients, and law enforcement with clear examples of how the law should be applied and enforced, really how it has been applied and enforced so people can make their own judgments. Second, requires the department to issue new guidance documents to provide examples of methods health plans may use for disclosing information to patients and making coverage determinations that will help bring clarity to patients about how mental health coverage decisions are made. Finally, requiring the Department of Health and Human Services to produce an action plan for improved state and federal coordination of enforcement of existing mental health parity laws. That will help ensure that the right government officials are sharing information and working in a comprehensive manner to assist patients when they're seeking coverage of mental health benefits. Is there further discussion